Thank you, everyone. It's a privilege to be here at the first one, and to be here talking about HIV 101 or HIV in New Zealand. I have to confess, although I have presented before, I haven't presented on this topic. So I'm actually kind of glad none of my colleagues are here to to see how well I do, because this is usually something that some colleagues of mine would probably do better than me. But so to start with, what is HIV, and what is the difference between HIV and AIDS? So as many people may know, HIV is the virus itself, which is transmitted between people, and whereas AIDS is a series of symptoms that occur if HIV is left untreated. Doctors will call them opportunistic infections, which basically means the HIV virus will over time destroy the immune system, and if left untreated, the immune system will not be strong enough to defend against certain cancers and other infections that can develop in the body. So that's the difference between HIV and AIDS. A lot of people, as you may know, will confuse the two, and the general public will still often refer to AIDS when those of us who know better know that there is actually a difference there. What is the risk or the risk factors? Is this a clicker for the... Oh, okay. So what are the risk factors for contracting HIV? So there's a few key ones, and it's really important to know what are and aren't risk factors. So the first one is unprotected sex, and really there we're referring primarily to unprotected vaginal sex and unprotected anal sex. Unprotected oral sex is relatively low risk, although it can happen. It's relatively uncommon. Sharing needles is another risk factor. Breastfeeding is another risk factor, so from mother to child through breastfeeding, and blood-to-blood contact, which could refer to if someone was getting a blood transfusion back in the early days in the 80s before they knew about it. Some people were infected through blood transfusions and blood transplants. So that leads us to who's at risk. And so those different, transmission risks have evolved or developed certain groups of our community that are more at risk than others because of those different factors. I should mention here too, by the way, I'm happy for questions throughout rather than waiting till the end. So gay and bisexual men are one of the major at-risk groups, and there's a few reasons for that which I'll go into a bit later on, and heterosexual men and women. Both of these groups primarily contract HIV through unprotected sex. Sex workers as well. This is more internationally. Sex workers are an at-risk group, same as people who inject drugs through sharing needles, and mother-to-child transmission, which can happen through childbirth or through breastfeeding. So we're quite unique in New Zealand in that these bottom three here, sex workers, people who inject drugs, and mother-to-child, they're not very highly represented in HIV statistics in New Zealand. And that's thanks to the work of a number of partner organisations of ours. So the Prostitutes Collective have done a fantastic job of really making sex with condoms almost universal amongst sex workers in New Zealand. And the Needle Exchange Program has exchanges operating throughout the country, which means that people are able to swap needles, and so very few people are sharing needles. In fact, the numbers in New Zealand are very small. I think in the last 4 years there's been about 4 or 5 transmissions through people who inject drugs, no known through sex work. And mother to child, we've had no infections for a number of years, and that's thanks to the national screening of pregnant women. So whenever somebody becomes pregnant, they'll be tested for HIV, and if they're HIV positive, they'll be offered treatment which significantly reduces the risk of transmitting to the unborn baby or transmitting through breast milk. So that leaves us with our two main groups in New Zealand, which is gay and bisexual men and heterosexual men and women. So looking at heterosexual men and women first, so looking at the trend over the last 10 years in terms of the number of people who are diagnosed with HIV each year who identify as heterosexual, you'll see it's dropped quite a lot, and it really grew a lot in the early 2000s, coinciding with a lot of migration from high prevalence countries. There's a lot of people moving to New Zealand with HIV, and in 2005, the government basically changed immigration policy, which made it a lot more difficult for people who already had HIV to move to New Zealand. A couple of exceptions there now. If your partner is a New Zealander, it is a bit easier than it was. But that, as you can see, has made a huge change. So the light green bar here is the number of people who are diagnosed with HIV who believe they were infected in New Zealand. And that's remained relatively stable over 10 years, but the big drop there has come from those people who were infected overseas. And the next group is gay and bisexual men, who account for the majority of HIV infections in New Zealand. And this is the trend over the last 10 years. You can see it's been relatively stable. I could have gone back further. It actually was very low in the late 90s, early 2000s. We were looking at around 20 diagnoses each year. And that was because, basically because of, in the late 90s, we got drugs which kept people alive, and since then it sort of quickly grew in the early 2000s, coinciding with what we believe were a range of factors, but one of them being internet dating, which sort of created a new dynamic of sexual networking that wasn't necessarily available before. But since about the mid-2000s, it's been relatively stable. In the last year, 2014, has been the biggest year, I think for a very long time. Maybe it was that high back in the 80s. So it's too early to say whether this is a trend, whether it's on the rise again within gay and bisexual men, but it is still very concerning that we're seeing such a big number. And it's an increase both in, primarily in those infected in New Zealand, which is the light green bar there, with the grass green bar. Infected overseas is relatively stable over the last 10 years. And infected overseas would refer to those New Zealanders who were living overseas. Maybe they moved to London for a few years or to Australia for a few years. We'll also refer to those people who are citizens of other countries who maybe are here studying or here on a work visa who happen to be diagnosed here. We know that in NZAF's service, last year our testing rates were up 23% on the prior year. And basically for the last 4 years, they've grown 25% every year. So it's almost double what it was 4 years ago. But that's just our service, and we don't necessarily know whether it's like that across the board. But certainly more people testing will contribute to that. And also in the 2014 figures, there was a increase in the proportion of gay and bisexual men who had a high CD4 count at the time that they were diagnosed, which basically means that it's an indication that they had been infected recently, as opposed to some time ago, which would, making a lot of assumptions, but would indicate that increased testing rates could be a part of it, because you're picking up newly diagnosed rather than people who've been living with HIV for a long time. But yeah, a lot of assumptions get made in interpreting the data. So looking at the proportion of diagnosis, so gay and bisexual men make up 80% of the HIV where the person was infected in New Zealand. And when you compare that to the estimate that gay and bisexual men make up 2.5% of New Zealand's population, you really get to see the overwhelming burden of the epidemic on this group. And there's three key reasons really why gay and bisexual men are so overrepresented in HIV statistics, and not just in New Zealand, but every country in the world. Even people often assume that in sub-Saharan Africa it is primarily a heterosexual epidemic. But if you look at the rates of infection in gay and bisexual men in every country, even sub-Saharan Africa, it's exponentially higher than it is for the heterosexual population. And these three reasons sort of explain that. The first one is a biological reason, and it's that unprotected anal sex is 18 times riskier than unprotected vaginal sex in terms of the risk of HIV transmission. And that applies to other STIs as well. I mean, the figure might change. 18 times is specific to HIV, but basically unprotected anal sex is a very easy way for HIV and STIs and infections to enter the body. Add to that the fact that this is from a study in Auckland, that 1 in 15 gay and bisexual men in Auckland already have HIV. So we have a higher prevalence than the heterosexual population. There's just more of us around who have HIV. And then you add to that sexual networking, which basically the pool of gay and bi men is smaller than the pool of heterosexual people. So when people are meeting other people for sex, gay and bisexual men have a much smaller population of people to choose from than their heterosexual peers. So it just means that we're much more closely connected than heterosexuals, and that allows infections like HIV and other STIs to spread much more quickly between us than is the case for heterosexuals. So when you add those three things together, it really explains why gay and bisexual men wear the brunt of this epidemic. So in terms of preventing HIV, I'm just going to focus on preventing HIV during sexual transmission. We sort of covered off some of the other risk factors earlier. The first and obvious way to prevent HIV during sex is condoms. Condoms are very effective at preventing HIV, not just HIV, but other STIs. They're very simple and affordable, and they're verifiable. You know whether somebody is using one or not. The other important thing we need to do to prevent HIV is test more. Testing more allows us to reduce the amount of undiagnosed HIV within the community. And what we know is that it's people who don't know that they have HIV that are passing on the majority of new HIV infections. So by testing more, we can get those people who don't know that they have HIV on treatment and at much less risk of passing the virus on to others. And that brings us to our third thing, which is treatment. There's a lot of data now which shows that being on treatment and having an undetectable viral load very significantly reduces the risk of passing on HIV. So the more people that we can get tested and onto treatment, the least risk there is, combined with condom use as well, of HIV being passed on in the community. And then the fourth thing is pre-exposure prophylaxis, which is a drug, one pill that is taken daily. And when taken daily, it ensures that there's enough HIV medication in the body to significantly reduce the risk of contracting HIV. At the moment, it's very expensive, and if you don't take it every day, the risk is higher. It's not as effective, but it certainly has a place. We know that there are some people who very strongly resist using condoms, and if those people have access to PrEP, that's a lot better than nothing. PrEP won't prevent any other STIs like Hep C or syphilis or gonorrhea, but it will provide good protection against HIV. So we're currently working on a demonstration project in New Zealand, hopefully to be live by the end of the year, ideally. So I just wanted to show a few resources. I've got some in my bag if anybody wants to take them, or you can order them from our website. So we've got a brochure on the health services that our team offers, and there's also this brochure here, or a booklet, which is everything you need to know about HIV and AIDS, and it basically goes through everything we talked about tonight, in relatively easy to understand terms about everything we talked about. And the last thing I just wanted to mention was I don't actually have this; it hasn't gone to print yet, but we've just finished working through a new booklet called Living Well with HIV. That is something that when our testing clients are diagnosed with HIV, they'll be given that. So it covers everything from the initial diagnosis through to support and services that are available, not just through NZAF but through our partner organisations as well, and discussing treatment and relationships and sex and undetectable viral load and all the things that people need to know, really. So that will be available through our clinics and also on our website if anybody wants to order it. And also just wanted to do a plug for the website itself. So there's a range of information available on the NZAF website about everything we talked about tonight, plus a whole lot more, really. Cool, well thank you. It was a pleasure to be involved in the first one. Cool.